So the first question is related to going back to work. This mom is 2 months postpartum. She's going back to work next month, and she wants to know how to prepare. She has a good milk
Stop.
supply.
Mhm.
Yeah, milk supply. She hasn't started pumping yet. So she
Okay.
wants to know what to do.
Okay, great. Definitely not only getting some stock going, but introducing the bottle, which we've talked about before, but with going back to work, getting stock going with pumping, but also making sure baby is taking a bottle once or every other day so that baby will do well with that. With that in mind, beginning some pumping will also have some stock in the refrigerator to offer baby a bottle. So this is one thing that I get questions on with prep for back to work is yes, we want to get some stock in the refrigerator, but you're also wanting to be making sure baby will go back and forth with breast and bottle well. So with that in mind, tips on building stock with getting ready for back to work is pumping after your morning session. In the morning, when you're starting your day, you're going to notice after sleeping overnight that your prolactin is higher. Therefore, you have more in the morning. Often moms are like babies gulping and, there's so much milk. And so it is a great time. My tip would be if baby just feeds on one side, just pump the other side for like 5 minutes, just enough to get some stock, but also not take away from the next feeding. Okay. If baby feeds from both sides, you could go ahead and pump both sides for 5 minutes. If you can, try to pump as soon after breastfeeding as possible. So if your partner's there to help out with burping, changing diaper, and we're done with the breastfeeding session, we do a quick 5-minute pumping. That allows your body time to replenish for the next feeding, but you do still get some stock. Okay. The other good time to pump is with baby sleeping longer at this stage, potentially, is to pump before you go to sleep. So if you feed baby 8:30, whatever, and you're going to go to bed at 9:30 or 10, pump before you go to sleep because you're about to go to sleep, which will replenish your supply well for baby's next feeding, either in the night or in the morning, depending on how long baby's sleeping. But it can help control engorgement by pumping before bed, but it's also a great stock bottle to just, so let's say that morning one, we save that to give the bottle at some point. The one before bed is just a great stock bottle, or vice versa. I have some parents that prefer for partner to help with bottle feeding as we're working on bottle feeding. We want baby to see a different person, a different nipple type, and recognize I can do both. And so with that in mind, some parents will do that bedtime pumping alongside baby getting a bottle. So the big thing is when we give a bottle once a day, of course, we're going to pump at that time. So a lot of parents find sometime in the evening is most typical when partner is home, that they could help with give a bottle before bed. Some parents like because you can make sure they get nice and full and actually be able to assess that and see if that helps baby sleep longer. So with that in mind, just make sure when we give a bottle, we always pump, and that replenishes your stock for the next day. You may be ahead of baby. Let's say baby's taking 4 ounces and you pumped 5 or 6. You will proportion out that 4 ounces into a prepped bottle for tomorrow. And the 1 or 2 ounces we can have to add together to get some 4 ounces for back to work. And I say 4 ounces, but some babies take more or less. My reflux babies who deal with reflux symptoms, they often prefer around 3 ounces. They prefer smaller feedings more frequent. My babies who are going to be big, tall boys, for example, they may take 6 ounces at 3 months. I mean, we have all ranges, and also their feeding frequency matters. Babies that feed small feedings more frequent are feeding all through the day more frequent. And then babies that take more volume may just feed 5 times in 24 hours. So definitely some dependent factors there. But the main thing is if we're doing some pumping to get some stock, either just the opposite side if you're a one side feeder, or both if you do both in the morning, and then get that stock going in the fridge. The recommendation is taking your warm milk and combining it with cold milk in the refrigerator. So with that in mind, you pumped, it's warm, put that in the fridge, you've got a cold one. Once they're both cold, the recommendation with the CDC is to combine cold to cold. So get that stock going. You can mix together over 48 hours safely. Just use the older date if you are going to your freezer stash. Okay. So Yeah, in review of milk storage guidelines is breast milk is good 4 hours at room temperature, 4 days in the refrigerator, and 6 months in the freezer. Okay. So with getting stock for back to work, we'll get some freezer stock going. Another tip with back to work is when baby takes a bottle, when you're apart from baby for the first day, we're going to use fresh milk if possible. So the saying is fresh is best as far as the nutritional need and all of that for baby. If we've got fresh pumped milk in the fridge, that's what we'll have for daycare or nanny or family. Then when mom is at work that Monday, she would be pumping at work for the next day.
Mhm.
So thoughts on that with the fresh is best is that it helps moms realize we don't have to have a whole freezer full to go back to work. A lot of moms are very anxious about that. I saw whoever online and she had a whole freezer and I don't.
Instagram. Yeah.
I'm not gonna have enough milk. Look how much they have. And it's this comparison. But I have had moms get away with, a day's worth, maybe 24 hours worth, just that we dip into that freezer stock as needed. And often back to work, we may be pumping as well more than baby needs.
Yeah.
So, and in regards to if I have moms like her, if she has a higher production and she's able to get that freezer going pretty good, we'll always use the oldest milk first in the freezer, right? So we're getting through our stock. But on Friday's milk, Friday, if it's a Monday through Friday worker, take Friday's milk, put it at the back of the stash of the frozen milk. Okay. So that way Monday we could dip into the freezer stash and use the frozen milk. And then the rest of the week it's fresh as best. Okay. And then the Friday's milk goes to the back. So some moms are like, how can I get through my freezer if I keep using all my fresh? I feel like I'm never going to get to it. So that is a way, if you do have a freezer stash, to use Monday for the frozen milk.
Yeah. That works really, really well. I did it for over a year and it worked really well.
Yeah. Yeah. So definitely can do it. The big thing I run into the most is the bottle concern and baby taking a bottle. It's a whole nother question, and making sure baby will go back and forth with breast and bottle. The recommendation is actually 4 weeks old, around 4 to 6 weeks old, once a day. It's often difficult. And at 2 months, I find a lot of moms are still kind of like, we're doing the bottle here and there, but breastfeeding gets so easy. At 4 to 6 weeks, they just latch on and they're done in shorter time and it gets so easy. But we do want baby to see the different bottle nipple types and see which one works for them. Flow is a big thing with bottle feeding. If baby is used to your very fast flow, of course, with bottle, you'll see the preemie flow nipple in the early days, newborn flow 0 to 3 months, medium flow or size 2, 3 to 6 months. But a big tip is if your baby is refusing or frustrated with the bottle and their eyebrows and they're fighting it, don't forget about the flow side of things. You might try going up a size on the milk flow. And then distraction techniques if baby's fighting it, when baby's more sleepy. I love if partner can give the bottle so they're used to seeing someone else, but sometimes mom has to transition to, they give the bottle first where they're comfortable and then work towards partner.
Yeah, that's really important to get that done when
Yes,
they're little. Because what happens is you get so comfortable breastfeeding. You're like, oh, I got this. Like, I stay home for 5 months.
Yes.
And
Yes.
I was like, I got this. I don't need no bottle. I'm good. I was with him 24/7. Why would I pump? Why would I do that?
Work.
It's more stuff to wash and sterilize after. But no, because if you don't do that and then they refuse the bottle, it's just so hard.
It really is. And you can get through it. I will do what's called a bottle feeding boot camp with them and it can take anywhere from it's usually around a 3 to 6 months or 4 to 7 months that they'll have this fighting it. And then eventually their hunger and all of that, 6 months old, their nutritional need continues to increase to where they're more hungry and they'll often start taking it better. But that would often take mom is not an option literally for each day, and they'll start off real small amounts when they're apart and then work towards, okay, I'm hungry. And so, but I do find these days a lot of people are getting more maternity leave, even up to a year, with a lot of the moms I meet with. And so they're working from home post-COVID. A lot of moms working from home, which makes do I need to bottle feed as much? Yes, I'll have meetings and such should be great. So, but yeah, that's some tips on that with back to work and bottle feeding.